Minimal incision surgery is also minimal invasive. This gentleman was an elderly gentleman who just wanted to be more comfortable in shoes. We weren't going for beauty, we were going for just to remove the bump, try to get him comfortable. He's been suffering with this bump for quite a few years, and he's been removing the tongues of his shoes just to fit into them, and we're scared about ulceration. His blood test, which we always do before any kind of bone surgery, or any kind of surgery for that matter, shows that he's very healthy. We did a Doppler that showed very good circulation to this foot. Although he's elderly, we weren't concerned about healing, but still we had to be very cautious, and I figured the easiest way to remove this was just to remove the bump. Everything is done sterilely. There is no shortcuts with sterility. We use a Shannon 44. The incision was made with a 67 blade. It went right to the bone at a good angle. That's why I didn't need a rasp to open it up or to get in there. It's such a small incision. Basically, throughout the entire surgery, you have to keep milking the bone paste out. You'll see the bone paste come out in globs. It almost comes out looking like toothpaste. Furthermore, we constantly are using a C-arm. Couldn't show that because it just blocked the entire film, but there is a fluoroscope in the room that is draped and it's sterile, like everything else in this room. And we were using that consistently throughout the entire procedure to see how much bone needed to be removed. Once it was removed to the point where I felt he would be more comfortable in shoes, the problem is that the area starts to swell. So to keep down the swelling, what we use is sterile transport tape. We have an autoclave as well as a gas sterilization by Anderson, and this tape is completely sterilized prior to placing it on the patient's foot. We then use cling, followed by medicated bandage, which will help keep down the swelling, followed by more cling. You saw how small the incision is. My biggest concern is swelling at this point, so we put on a compression bandage. We place the patient in a surgical shoe and have him elevate for several days. We will change this bandage in anywhere from 5 to 7 days, but we will talk to him in between and make sure everything's fine. He will be in bandages approximately 3 to 4 weeks, depending on how much swelling and how well he heals.